I completely understand. There are just some days on placement, by the time you've settled, you've finished cooking, there doesn't seem to be any time. So what we're going to try and do is maximise that time that we have while we're actually in the hospital. Number 1, study on the go. So when you're on your ward rounds or the clinic, you're going to come across topics that you've never heard of before. And while you're following along to what you're seeing, your brain is going to start giving you prompts. Okay, why is that? And why is that? And so what you want to do is when that happens, you're going to use the lightest textbook at your disposal, which is your phone. Granted, first you want to make sure that you're finding an appropriate time to get your phone out. But when you do find that, try and look up your query as soon as possible after those prompts come to your head. Seeing something that confused you and then resolving it soon afterwards really helps to just solidify that into your mind. Your brain is going to make that connection between the information that much stronger than if you'd left it to revise at some point in the week. I know that it'll stick so much more if you do it right there and then. And share it with your placement partner even. Just repeating it out loud and saying it to someone else allows you to test if you actually understood the concept correctly. And you never know, your placement partner might think of an amazing mnemonic to help you remember it with. Or equally, they might have had a really interesting clinical story that related to what you've just read. Because sharing information is always going to benefit you both. There is absolutely no use to keeping anything to yourself on placement. Number 2, ask questions. I really do appreciate that this can be pretty intimidating, especially at the start of placement. But really, when you're unsure on something, ask the senior doctor the thing that's been confusing you. For the most part, they're actually really going to appreciate your question because it shows them that you've been paying close attention and actually want to find out more. Besides, you're always going to be in a much better position having asked than if you'd have stayed quiet and never fully resolved your question. Now, at first, that can be pretty nerve-wracking. So if you do feel a little bit nervous, start off with junior doctors or old medical students because they are really a great place to start. Being close out of medical school, they too will definitely remember the feeling. Number 3. Take histories as often as possible. Observing is key to obtaining knowledge outside of your books. And yet, a learning tool that's not really used by a lot of medical students is actively going to take a history. Now, for many of us, doing histories and examinations is pretty much seen in the context of our sign-offs, so we do associate doing them with a little bit of stress. But look, I am sure that you are more than capable of sitting down by your desk and memorizing a topic. But like the point of this video, it's really difficult to actually find the time to do that. But even when you do, it's pretty hard to find a way to make that information cement in the long term, however capable and smart you are. And why? Because your brain doesn't have an anchor for that information. It has no experience to connect what you've read with what you've seen. And therefore, by speaking to patients, going from bed to bed, you're going to uncover a myriad of conditions. And you'll find that actually most patients know quite a lot about what they have. And the nicest thing is that most of the time they are really more than happy to explain it to you. And another benefit to this is they're going to explain it to you in patient terms. Now, what do I mean by patient terms? What I mean by that is they're going to explain it to you in a succinct way. And this is because that's the way that it was explained to them. How does that benefit you? Well, on the one hand, you're going to hear it in a pretty succinct way, which is great if you're starting out. But also, it's going to give you a really good indication of how to simplistically explain difficult concepts to patients in the future. And then, as I've mentioned before, after you've spoken to this patient, try and go to the side, go on your phone and look at the condition that they've mentioned to you. You'll then recognise that most of the typical presenting complaints are going to match the patient that you just spoke to. So memorising this concept is more going to be about recalling the conversation that you had with Betty or with Carlos or with Miriam. So even for you, it's going to feel less like a strenuous task and more reminiscing on a conversation. Because what does a conversation give you in comparison? It gives you emotion. Emotions you associate with that conversation will allow you to cement that further into your mind. Number 4, go to the hospital's library. I know that as a student who's just starting on placement, it can be kind of awkward to say yes to the offer of leaving by a doctor or a nurse, because you don't really want to appear rude or make them feel that you don't want to be there. But if they have offered, then they know from experience when a particular day is going to be conducive to learning or not. But equally, you can take charge. If you feel that your learning would really be best supported by a bit more supplementary reading, think about proposing it to them. So let me give you an example. Let's say you come into the hospital at 9 a.m. When you get there, you're told all the things that are going on throughout the day. And one of these things is a PCOS clinic until 2 p.m. If, for example, you didn't know much about PCOS, you could go up to the doctor in charge and say, since I'd really like to maximize my learning experience in this clinic, do you mind if I take the first hour of this morning today to go and study up on PCOS in the library? You will find that the person on the other end is actually going to be really appreciative of your conscientiousness, and it'll make you a lot more prepared if they do want to then ask you questions when you're in clinic. It's also quite nice to feel that you can answer a question, especially when it's a tricky one. But equally, if they say no and they suggest to you that it's best for you to come straight to clinic, that's fine also, because you've made them aware of an area of improvement that you know that you have. And so when you get to clinic, they're aware that they can potentially point in your direction a few more pieces of information. Equally, they might give you a list of topics to read up for the next day based on what you said you do know and what you don't know. And number 5, do practice questions. Being on placement, yes, is a lot of observing, but you'll find there's actually a lot of waiting around time as well. Whether it's because a patient's arriving late, or a doctor is writing up some medical notes, or even just time that you have in between teaching. I want to preface this by saying, I don't advocate for you to fill every single non-working moment with practice questions. However, whenever you can, and when it's healthy and sustainable for you to do so, log into websites like PassMed, KenHub, Osmosis, or any other sort of single best answer software to keep questions ticking over in your mind. To make it more specific to the placement block you're on, try and narrow down the searches to the specialties that you're currently on placement in. Linking back to the whole asking questions aspect too, if there's something that comes up in those questions, you'll have a doctor or a nurse sat right next to you who works with these cases day in and day out. So who better to ask than someone who sees this topic every day? So I really hope that this video helped you out there. In my opinion, placement is really fantastic. I really do think that it's what makes really great doctors. But it's natural that we all worry about these things, especially at the beginning. The best thing you can do is just allowing yourself that time to figure it all out. And though it may not feel like it right now, you really will. So if you will have any other suggestions that you want to share with everyone else, pop them in the comment section down below or send them over to us so we can pass them on. I wish you all the best of luck with your placement blocks, and I will see you guys in the next video.